Uh, Hi again, everybody. My name is Deborah, Pride Northwest, and we're here today to talk to Tyler TerMeer, who's the Executive Director of Cascade AIDS Project, CAP, as well as Peter Parisot, who is the Chief of Staff for Cascade AIDS Project. Thanks for joining me, guys, and thanks for coming to share CAP's story and reach out and connect with community. So let's start with basically what is CAP? What kind of programs do you have? A little bit of your history, what your priorities are right now, and we'll just take it from there.
Yeah. So I'll get us started, but Peter, feel free to chime in. Cascade AIDS Project is Oregon and Southwest Washington's oldest and largest community-based provider of HIV-related social services. We, for the last 35 years, we're celebrating our 35th anniversary this year in 2020, have been providing a set of social services to the community that most people know in a couple of different ways. A lot of people know us for our prevention services. So we provide access to low barrier HIV and STI screening to the community here in Portland at a site called Pivot at Prism Health in Southeast Portland, and then in partnership with a couple of other counties in Clackamas and Washington County to ensure that the community has access to low, free HIV and STI screening. We also are providing in that department linkage to care services, as well as navigation services to ensure that people who might need navigation towards their insurance options, whether that's private insurance, Medicaid or Medicare, or if they need access to navigation around access to PrEP, pre-exposure prophylaxis, or the pill to help prevent HIV infection, that they have the resources they need to make those things accessible and affordable. Along with prevention with positive programming for those who are already living with HIV but might need some tools to help them navigate life, staying safe, living with HIV. And then our largest scope of work has always been in housing. We really believe in housing as healthcare, and we put several $1 million a year out into the community to help people pay for short and long-term rental assistance. Mm-hmm. And in order to help people find stability in their life, housing case managers are working in tandem with peer support specialists and culturally affirming navigators, providing population-specific work in the Black community in partnership with Urban League or with the Latinx, Latina community. And then, we have everything from employment services to a furniture warehouse program to all of the things that are going to help you find stability in your life. And then finally, over the last 3 years, we really evolved and expanded our mission, which is currently we support and empower all people living with and affected by HIV, reduce stigma, and provide compassionate healthcare to the LGBTQ+ community and beyond. And with the expansion of that mission, we opened Prism Health, which is our culturally affirming, federally qualified health center lookalike, providing primary care, gender care, and behavioral health services to the LGBTQ community that's really centered in understanding the unique health disparities of the community and approaching the work through a trauma-informed lens.
So just a couple of things.
Just a couple of things, but I think 35 years of really rich history, and we've grown over time based on what the community has wanted to see from CAP, and we've learned from those years of experience, both the good years and the bad.
Right.
Yeah. The only thing that I would possibly add to that is we do a lot of public policy work as well. So Tyler and I work on both the state and federal level to make sure that the federal response to HIV is fully funded, that our federal delegation is doing what they need to do to support people living with HIV. And then on the state level, we also work with the state legislature to secure funding for these projects, to do things like statute modernization. We did a bill a couple of years ago to clean up Oregon statutes around some stigmatizing language that was around HIV and the way they talked about it in statute. So I think that's the other big piece of work that we do is policy as well.
Right. Okay. Well, I'm going to make the assumption, as I'm sure everyone is, that the current pandemic, COVID-19, all of the fun, exciting times are directly intersecting with your work. Maybe give us a little bit of a snippet of what is that doing? How's that impacting CAP in what you're doing, what your priorities are, and your resources?
Sure, I can tackle a couple of the departments. So, you know, the COVID-19 crisis has really forced us to reevaluate how we do the work. So obviously everybody is at home working remotely right now. So we've been really focused on how do we provide the same scope of housing and support services to folks in a remote fashion, where people used to come to our office and get one-on-one care. How do we do it in our, you know, over the phone or via Zoom meeting? So that's been a lot of it. We've been really successful getting people into housing and maintaining their housing over this last, I guess, 3 months of time, and really spending a lot of time making sure that people who are medically vulnerable, so people living with HIV or other health conditions, are able to access emergency motel and hotel vouchers.
Right.
And that has really been a game changer for us. We've now housed something like 55 people in motels each month. It's been a lot of work, but we're making sure that those people have a safe place to stay during the crisis, and they can stay there for as long as they need to until we're able to secure for them longer housing options. Our prevention department, you know, as Tyler mentioned, does HIV and STI testing in a low barrier and free way. But we haven't been able to do that because of the restrictions on person-to-person contact and the lack of protective gear. So we are now just looking at reopening those services to the public in the beginning part of June. So by the time this is aired, we'll be open again. But it's really been, it has been sort of just an all hands on deck effort to try to figure out how to provide the same scope of services to make sure people aren't getting lost because they don't have access to phones or they don't have access to email anymore. So we've actually been purchasing phones and giving them out to folks so they can contact us. We've been doing weekly food delivery boxes to people in motels so that they have enough to eat and that they have enough to get by week to week. We've been doing support groups online and telephone check-ins with our client to make sure that they have the social and emotional support that they need to get through this trying time.
Nice.
Yeah, and then over at Prism Health, we also have had to figure out how to transition our primary care and gender care as well as mental health services over to a telehealth module, which we did fairly early on in all of this, and have been really successful at keeping folks connected to their care options in a culturally affirming way. All of our providers are working from home most days. Some days they're in the clinic, but most days they're working from home and providing those services remotely to our patients, but also recognizing that some of the patients that we serve would need access to essential lab services. So whether it's for the trans community who might need ongoing gender care labs related to their hormones, or for people who need access to ongoing labs because of some other health condition, we've remained open 3 full days a week just for our on-site lab services for folks. And then we were successfully able to launch a drive-up COVID-19 testing site for our existing patients, as well as people who are considering wanting to establish their care at Prism Health for primary care.
Right on. So if folks want to get involved, find out more, and maybe most important at this juncture, support what you're doing, what's the best way for them to connect and to do that?
Yeah, I mean, I think the best way always to find out what's happening at CAP is to visit our website, which is capnw.org, or our social media sites to see what's happening at CAP. We've added several new resources on our website that talk about CAP's response to COVID-19, and that will keep folks both informed, but also let you know how you might get involved. Right now, we've really been trying to keep the community informed about what we're doing, but also engaged. We, like every other nonprofit in town, have certainly felt the impact of COVID-19 on our fundraising efforts, whether that's individual donations or events. We had to move our largest fundraiser of the year, the annual CAP art auction and after party, to July, which is now going to be in a virtual format on July 11th. And we're hoping that people will tune in for the first time in our history of that event, which is going on 30 plus years of having an auction for CAP's vital services. It will be an event open and free to the community to attend in a virtual way. And so we're hoping for our 35th birthday, we can give a gift to all of you to be able to see and experience a reimagined CAP art auction, and that folks will be able to give a gift that perhaps is meaningful to them in some way to support not only the work that we do throughout the year, but the work that we've had to enhance during COVID-19. In response to that, we created a community action fund where folks can donate at any level to support the work that we're doing now and will continue to do throughout the pandemic, and are looking at ways to get our volunteer community engaged, either helping us deliver food once a week or by helping us make masks for our staff. So the cloth face coverings that can be made at home for our staff to wear while they're out in the community, or to hand to our patients as they walk through the door if they don't have one.
And so the website's the best way to connect to all of those. Okay.
Yep, capnw.org.
Okay. Finally, what message do you have for the community? If you wanted to say something, whatever it happens to be, what would you say in this time?
Oh, it's such a big question, Deborah.
Yes, it is.
You know, I think from me, I would say that, you know, we're still here. CAP for 35 years has been an organization that has helped people put their lives back together after a life-changing diagnosis, or has provided empowerment for people to know their status so they can live a healthy HIV negative life. And we are still here for you in all of those ways. It may just be that we have to interact a little differently during this time, and that we'll get through this. I think everyone is using their own terminology of, you know, we'll get through this together, or we'll come out better on the other side. But I think CAP is really hoping that the community will stay socially connected during this time, and that we will truly be stronger on the other side, because our community is a resilient one and always finds ways to get through the toughest of times. People in the LGBTQ community, especially those who lived through the 80s of the HIV epidemic, surely know that we know how to survive a plague together as a community, and we will certainly survive this one as well.
Nice. Peter?
I mean, I think Tyler really hit the nail on the head. You know, the queer community is one that, you know, is resilient at its core. We've been through a lot, and we will continue to go through a lot, I imagine. But we are obviously a stronger community together, and I want us to really remember that, you know, that sense of community, and that we have to hold each other up and we support each other through these times. And so I think that's the thing that I love about the queer community. That's the thing that, you know, that I really felt embraced by. And so I know that we can do this, and I know that we can continue to thrive despite the challenging circumstances. So be resilient, be strong, support one another.
Agreed. Well, thank you again for joining, working to give as much visibility to your work and to what you're doing in the community as we possibly can. I want to thank both of you for doing what you do, and for being part of Pride. Thanks a lot.
Thank you.
Yeah.